Neutropenia, a condition marked by an abnormally low count of neutrophils, can signal a range of underlying health issues, from medication side effects to complex autoimmune disorders. A recent AAAP episode delved into crucial insights for understanding and managing this condition, shedding light on its diverse causes and the unique implications each carries. One of the most recognized causes is chemotherapy-induced neutropenia, a predictable side effect of many standard cancer treatments. Physicians note that the lowest neutrophil count, often referred to as the nadir, typically occurs anywhere from 7 to 14 days after chemotherapy administration. It is during this period, before recovery to a safe level within 3 to 4 weeks, that the risk for febrile neutropenia becomes significantly elevated. Indeed, while understanding the timeline of chemotherapy-induced neutropenia is vital, recognizing the emergence of febrile neutropenia stands as a critical oncologic emergency. This serious condition is defined by a single temperature greater than 101 degrees Fahrenheit or a sustained temperature greater than 100.4 degrees Fahrenheit for at least 1 hour, combined with an absolute neutrophil count of less than 500 cells per microliter. When this occurs, immediate antibiotic administration within 1 hour of recognition is absolutely essential to prevent severe complications. Beyond chemotherapy, many other medications can trigger drug-induced neutropenia, an often unpredictable and idiosyncratic reaction. Unlike chemotherapy, this reaction is not dose-dependent, meaning even small amounts can cause it. Common culprits include antithyroid medications such as methimazole and propylthiouracil, various antibiotics like Bactrim and beta-lactams, as well as clozapine and sulfasalazine. Typically, neutropenia resolves within 1 to 2 weeks after the offending drug is stopped. However, re-challenging a patient with the same drug is strongly contraindicated due to the high risk of a rapid and severe recurrence. Interestingly, not all low neutrophil counts signify pathology. For instance, Duffy null-associated neutrophil count, formerly known as benign ethnic neutropenia, is a common and non-pathologic finding in individuals of African and Middle Eastern descent. These individuals often have a baseline absolute neutrophil count between 1,000 and 1,500 cells per microliter. Crucially, this is a normal physiological variant and does not lead to an increased risk of infection. For asymptomatic patients from these demographic groups with chronic, stable, mild neutropenia and no other concerning findings, further evaluation is generally unnecessary. Moving to nutritional factors, deficiencies in certain key nutrients, particularly copper, vitamin B12, and folate, can also lead to neutropenia, often alongside other cytopenias. These nutrients play a critical role in hematopoiesis, the process of blood cell formation, and their absence can disrupt myeloid maturation in the bone marrow. Copper deficiency should be suspected in patients with a history of bariatric surgery or other malabsorption syndromes, and it tends to cause microcytic or normocytic anemia. In contrast, vitamin B12 and folate deficiencies typically result in pancytopenia with a megaloblastic or macrocytic anemia.
Finally, a specific and severe manifestation of rheumatoid arthritis is Felty syndrome, characterized by a distinct triad of rheumatoid arthritis, splenomegaly, and neutropenia. This syndrome represents a severe extra-articular complication of long-standing seropositive rheumatoid arthritis. Its pathophysiology involves an antibody-mediated destruction of neutrophils combined with hypersplenism. Patients with Felty syndrome face a significantly increased risk for recurrent and severe bacterial infections, making careful management vital. Understanding the diverse causes of neutropenia, from acute drug reactions to chronic genetic variants and autoimmune conditions, is paramount for accurate diagnosis and effective patient care. Each cause presents unique clinical considerations, emphasizing the need for a thorough and thoughtful approach to this common hematologic finding.